I want to make sure we are all speaking the same language. So I'll give some definitions and some basic information, and we'll take it from there. And I'm really looking forward to, as I hope you are too, to the question and answer portion. Before I pull up my slides again, I'll just share a few words about me. So I am right now at home in Ridgefield, Connecticut. My name is Brittny Howell again. I'm a medical doctor. Specifically, I'm a board certified vascular surgeon, and I've been in practice for 7 years total, and just about a year in my own practice, just a few months in my own practice in Ridgefield, where I'm doing vascular surgery, but in a more integrative way than is typical. So one of the key pillars of our work in our practice, which is called modern vascular, is work with neuropathy. And so that's what we'll focus on in this conversation. So I will bring up my slides again. Okay, so I titled this talk, Relieving Peripheral Neuropathy Without Surgery or Medications. And I was careful and am careful to use the word relieving because I want you to understand that we're talking about something that's going to be more powerful than treating, and how treatments are often felt and how effective they may or may not be, but that I also really want to be careful about using a word like curing, because neuropathy is a challenging condition to have, and we're going to talk a little bit about why. So I thought to get us started, I would share some words of my patients, and the two patients that I chose are actually also, or have been, one has been, one currently is, an Ann's Place client. And you can read for yourself, I can read aloud too. Pain from neuropathy used to be a daily occurrence. Now it's a rare occurrence. And that's Lorraine. And without these treatments, I would not have been able to use my hands as much as I am right now. And that's from Roma. And Lorraine is someone who started her treatment with us just after completing her cancer treatment, specifically her chemotherapy treatment. Roma is a patient who is getting ongoing chemotherapy. And it's been really wonderful in so many ways to get to know her, but she's really found these treatments as an important part of stabilizing her, just keep her engaged in her daily activities. And we'll talk a little bit more about what that actually looks and feels like. So I wanted to start again with some groundwork and some basic definitions. And so we say neuropathy, and so we're talking about the nervous system, and specifically we're talking about the peripheral nervous system. So what that is a vast network of nerves, and those nerves carry signals from various parts of your body back to the brain and the spinal cord. And the brain and the spinal cord is your central nervous system. So everything outside of the brain and spinal cord that incorporates a nerve is your peripheral nervous system. And if you forget all of that, what's really important to understand about the peripheral nervous system is that it's simply an electrical network. And when we're working on treating it, when we're working on relieving symptoms, when this goes wrong, we're really working on electrical signals. And so then what is peripheral neuropathy? So that can be a number of conditions based on which nerves are involved, which groups of nerves are involved, to what degree they're involved, what functions are changed. But in general, it is a group of conditions that damage the peripheral nervous system. And so the way that damage looks, again, on the outside when it comes to symptoms and signs, can look like a number of ways. But it's either the loss of electrical signals, or it's that electrical signals are being sent inappropriately, or that they're getting changed in some way, they're getting distorted. And again, how you actually perceive that varies because we're so individual, but that's what's happening on the inside with those electrical signals. And so what causes it? And so I listed the causes in the United States from most common to least common. And most commonly, sadly to say, in the United States, peripheral neuropathy is caused by unknown causes. And when that happens, we call it idiopathic. There's a Latin root in there that means that it's unknown. We don't know the cause of it. And skipping ahead a little bit to number 5, what I truly believe is that a lot of the time, those unknown causes are actually environmental toxins, but we'll get there. The second most common cause of peripheral neuropathy in the US is diabetes. I think that's the cause that we most hear about in conversation, and certainly in the medical world, but it's actually the second most common cause in the US. Third is alcohol abuse. Fourth is chemotherapy or other toxic medications. And fifth is environmental toxins. And oftentimes those are things that we don't quite understand very well yet. There are things that are, yes, in the air, our greater environment, but then oftentimes there are things that are in our homes, like the household cleaners that we use, like the personal products that we use. And that's a whole other topic of a talk. So we talked about what is peripheral neuropathy, as in what causes it, what does it look like on the inside as far as those electrical signals, and then how it really affects patients, how it affects people varies. Again, we as humans are incredibly individual, but these are the things that we most commonly hear when we're evaluating patients. Most commonly, it's pain. And how that pain is perceived, again, varies. It might be a burning pain. Sometimes people actually describe it like an electric shock. Sometimes it's a sharp or stabbing pain. Sometimes people say it's aching. Again, it can feel a number of different ways, but pain is the most common thing that we hear about. Second is numbness. And that's actually a sign that neuropathy has progressed beyond pain. When those signals stop firing altogether, then we often have numbness. That numbness, either as it's recovering or as we're just leading up to it, might feel like pins and needles. We also hear about a tightness. Sometimes patients will say that it feels like saran wrap is around whatever the body part is. Like a shrink wrap, they say, like they have a sock on that's too tight. These are lots of things that we hear when people are trying to describe what often feels like it's difficult to describe, but I say that it feels tight, and oftentimes I'll say, yes, yes, it feels tight. And then last, we hear about unsteady walking. And so that might be just a lack of confidence in walking. Sometimes it's a lack of balance. Sometimes it's a lack of strength. But all of those things, again, however they describe them, when it comes down to it and we ask our patients, how is this affecting you? By far and away, the overwhelming response that it's affecting the way they live. It's affecting their ability to engage in their activities of daily living. One of our patients that I had the pleasure of meeting by now just about a year ago, his biggest wish when he started treatment was that he could start driving again, because he didn't feel comfortable with the pedals. He didn't feel comfortable that he was applying the appropriate amount of pressure, whether it was on the gas or on the brake. Another patient comes to mind actually considered himself a yogi 10 years ago. He was an incredibly dedicated practitioner of yoga. And he got away from it and would really like to get back to it. And yoga is really difficult to do when you can't really sense the floor beneath you or the mat beneath you. And so when we meet our patients, the question that they have, the question they really want an answer to is, can you treat what I'm feeling? Can this get better? And the quick answer is yes, but before I tell you how I think that neuropathy should be treated and how we really treat it, I wanted to talk to you about some treatments that you may have tried, you may have heard of, and sort of tell you the pros and cons of them. So to me, they really come under three main headings. The first is distraction. So distraction is really when we use some other modality to get our brain focused on signals other than the misfiring signals from our nerves, from our nervous system. And so a really great example of that is using a TENS unit or a TENS machine. And that's trans-electric cutaneous neurosignaling. And really what that does, what it looks like if you haven't seen it, is essentially pads being placed on whatever body part. Most commonly it's the hands or feet. Then it's connected to a really portable device. And then that device sends some stimulatory signals. Those signals, it's really important to know, are distracting signals. They're not signals that are focused on the nerves themselves, certainly not on the damaged nerves. What they're doing is sending signs to your brain to get your brain to focus on something else other than the misfiring of the signals from your peripheral nerves. So in that way, they're distracting. They're distracting you, they're attempting to, at the very least, distract you from what you're feeling, those feelings of discomfort. And again, the most notable example of that is a TENS unit. Then medications are really common. And medications are either meant to supplement, so vitamins, or in a grander use of the word supplements, or they're pain medications. So supplements can be something like a collagen or something from a naturopathic doctor, perhaps like magnesium, or something even more exotic like an ashwagandha supplement. Or it can be, again, something that's really focused on the pain relief. And in that, it might be something that's really meant to work on nerves, like gabapentin or Neurontin or Lyrica. And those are, again, medications that are focused on nerves. They are non-habit forming, but it could even be habit forming pain medication like opiates. And the third category, I think, is invasive procedures. Those procedures can be minimally invasive, like injections, sometimes alcohol injections or steroid injections, or anesthetic injections, like a regional block often is recommended by pain management doctors, or they're more majorly invasive, like the implantation of a neurostimulator, or perhaps actually operating on a nerve root. So those are the three main categories of what's commonly suggested. And they all have their pros and they all have their cons. I would say the pros of distraction is that it's simple. Most major insurances pay for it, especially if it comes from a medical provider. It's also widely available on Amazon for as low as $25 or so. The con is that it's not really a treatment. Again, it's a distraction, and that's really important to remember. Medications, it goes without saying, and the pros and cons of those would vary. I would say a con, especially for this group, is that you really want to be careful about what you're ingesting, whether it is quote unquote natural or holistic or not, because whatever it is, if you're taking it with the goal of it having some effect on your body, then it's a medication. It may be a natural medication, or it may be a human-made medication, but it's still a medication, and that means that it has the potential to interact with other medications. And so that's a big con. And then invasive procedures, again, the fact that it's an invasive procedure, and it tends to be the more invasive the procedure, honestly, especially when it comes to treating pain, the less satisfactory that outcome can be. We can talk about that in a more detailed way if you have questions about it. What we've really been taught in the medical community is that we can't really treat peripheral neuropathy. So though I just talked to you for several minutes about peripheral neuropathy treatments, when it comes right down to it, what we've thought for generations is that we can't really treat it. And there are three real reasons why. And that's the first reason is that nerves are the first things to get injured when your body is under some sort of attack. Now, whether it's a physical attack, like you had a motor vehicle collision, or whether it is an attack like a virus, or again, a toxic agent like a chemotherapy, nerves are so fragile that they're the first to go. Then on the flip side, they're also the last to recover. So as your body is recovering from whatever insult it is, and you're feeling overall better, just know that your nerves are the last to come along in that recovery. The third is that recovery is very notably uncomfortable, because as the neuropathy is progressing in severity, you often end up in numbness. And while that's uncomfortable, it's not painful. And then when you're recovering, and especially if you're recovering from numbness, there's very likely to be some pain involved. At the very least, there's very likely to be a really uncomfortable sensation, like that pins and needles, like a burning, like just a sensitivity even. So those are three reasons why we've really felt like peripheral neuropathy treatment isn't really effective. But that is until just about 3 years ago. And so what we really started to understand about 3 years ago is that you really can relieve peripheral neuropathy, and you can do it without the medications that I talked about a few slides ago, without surgery or other invasive procedures that I mentioned. But the key is that you really need an integrative approach. And the reason that we need an integrative approach, which I could argue we need for whatever ails us, but especially when it comes to neuropathy, is that it really requires an integrative approach to fix the electrical signaling. It's not just a one-sided, one-dimensional issue. We really have to approach it from multiple dimensions. And so this is just a brief overview of what we do in our practice. So when we first meet a patient and we have a consultation, it's incredibly important for us to get your story. And for us, and the way we're practicing, and a really important part of your story is, again, how it's affecting you, how you're feeling, how neuropathy is affecting the way you want to live. The second part of that is an examination, and it's a physical examination, of course, where we're really putting hands on, so it's an actual in-office examination, but it also involves some diagnostic procedures where we're actually measuring your blood flow to make sure that that's not an issue, or measuring your motor function, or measuring how you're able to sense. Then we're also measuring things that are really difficult to see on the outside, like other signs of the function of your nervous system, like how your sweat glands are responding, how the teeny tiny vessels, like your capillaries around your nerves, are behaving. And then third, if we decide together that you're a good candidate for our protocol, we move forward with talking about nutrition. And while nutrition on sort of a macro sense is really important, we're really talking about it on a more micro sense and what your nerves actually need. So we can approach it still by mouth, by actually prescribing some FDA cleared medical food, which is at a higher regulation than any sort of vitamin or supplement on the market, because it is FDA cleared, whereas in general, vitamins and supplements are not. But then we're also giving your nerves very directly with injections some of the key vitamins and nutrients that we know that they need in order to heal and regenerate. And I'll talk to you about what those are. The fourth part is the cell signaling. So the nutrition is really important for the nerves to have all the building blocks that they need to heal themselves and to regrow. And just like our bodies, again, on a global sense, we need to take care of ourselves by what we eat, our nutrition, but then also we have to think about how we're moving or how we're exercising. And the same goes for your nerves. But when nerves exercise, it's really about getting those electrical signals going again. So that's the other part of our treatment, and that's the cell signaling. And I'll show you again what that looks like. And that's at least twice a week. So it's a significant commitment, at least twice a week. We're treating you with a machine called the Synexus. And that's what's working on those specific signals between your nerve cells. Fifth and final, but not final because it's ongoing, is follow-up. So again, we're seeing each other at least twice a week. So we're seeing each other quite a bit. And then once your treatment regimen is completed, we're seeing each other every 3 months because we really want to continue to follow your progress, make sure that you're at least stable, if not continuing to improve. And if you're somehow regressing in some way, we want to make sure that we get to that sooner than later to get you moving forward. So I promised to tell you a little bit more about what I mean by nutrient therapy. So again, it's either by mouth or it's injectable. When it's by mouth, it is really a specially formulated B12 supplement is the simplest way to describe it. B12 and other B vitamins are really important to nerves. We've known that for a very long time, again, generations and generations. The challenge with B12 as how it's typically prescribed or purchased is that the vast majority of it gets gobbled up by other systems in your body well before it gets to your nerves. And then you waste the majority of it. It actually goes through your kidneys and into your urine. And so only the tiniest bit of B12, or most vitamins for that matter, that you take by mouth actually gets to the organ system of choice. And so we use an FDA-approved medical food that's actually formulated to bypass a lot of the gut, to bypass the kidney system and really make it to those nerves in a much more effective way. But then again, we also, and that's actually optional, and we are always open to talking to a patient's entire care team. So it's really important to make sure that we're all on the same page, but that is an option to really optimize the nutrition. But what is a standard part of our protocol is the injectable nutrient therapy. And that's not into the vein, it's not going directly into your circulation, it's actually going into the soft tissue right around the nerves. So oftentimes right in between the toes, sometimes just underneath the skin at the wrist, sometimes at the ankle, depending on what the symptoms are, we vary the location. And I have listed the most important components of that therapy. And this is a compounded solution that we make ourselves in our practice. And it's combined with an anesthesia, a little bit of lidocaine so that it's as comfortable as possible. And it's injected with each treatment. And then it's the cell signaling. So this is just an image of the Synexus machine. I'm hopefully going to show you a video so you can see what it actually looks like when it's in action. But this is the key to the cell signaling. So those white cords are leads. They're coming from the machine to your body. Most often in our patient group, it's to the legs and feet. And it's controlling what's called resonance, or again, it's really just cell signaling, the way those nerve cells are speaking to each other. And it leads to local, either right where the signals are being sent, or regional, like we're essentially creating a circuit. And so throughout that location, even if we don't have the leads directly on that spot, then it's a more regional healing because it's within the circuit, within the space of the circuit. It also relaxes muscle spasms, it increases local circulation, and those are benefits outside of just the healing of the nerves that allow you to feel relief sooner than later. And so let's see, with any luck, I will be able to show you this video. Let's see. Oh, let's see. I think I need to share this one. There you go. Beautiful. Hopefully, beautiful. Thanks, B. Okay. So this is the connection. It's a very short video, so I'm going to play it a couple of times. So this is on one of our lovely patients. Her symptoms are primarily in her feet. You can't really see the machine here, but we're focusing on her legs and feet. So she's actually got 4 suction cups on each side. 2 are on the legs, really on her calf, and 2 are on her feet, 1 on the top of her foot and 1 on the bottom of her foot. We don't always have to use those straps that are secured with Velcro. We certainly don't have to always use them on the legs, but if we do, it just allows more contact between the lead and the skin. And the better the contact is, the more energy you're going to feel. Patients describe it feeling a lot of different ways. There are a number of different programs, and everyone's experience is a little bit different, but it feels, never should it be painful. It should feel comfortable enough that you could actually doze off and take a little bit of a nap. But ideally, it's catching your attention such that you're feeling maybe a twitch or a twinge. It might feel like an electrical sensation. Oftentimes it gets going strongly enough that you will actually start twitching. Your toes might start moving, your foot might start moving at the ankle, or your hands might start moving at the wrist. And that's because it's bypassing your brain and actually telling your nerves to do different functions. So this is how it looks in action. Just gonna let it play one last time. Okay. Okay, and so that was really what I wanted to share with you. This is the name. I wanted to just give you the name of our practice and where we're located. We're located here in my town of Ridgefield. That's our phone number. You can, of course, call and speak with us. If you call, our patient concierge, Juliet, will answer. Our website is drbrittny.com, but then / will specifically take you to a page which will show a lot of information, a little bit in less detail that I just shared with you now. And you can also get in touch with us via that webpage. So I'm going to stop my share. And I'd love to have a bit of conversation.
Great. Thank you so much. That was really helpful and I think really great information. I noticed some questions that are now coming up in our chat box, so maybe I'll hit those first.
Okay.
Someone asked, Valerie asked, how many weeks does the treatment last?
So treatment it's a minimum of 24 treatments. So it depends on how frequently you come. So it is usually between 8 to 12 weeks. We can go up to, with insurance, with the blessing of insurance, up to 32 treatments in a row.
And someone else asked, what is the typical length of the treatment? So I guess each session, how long would that be?
Mm-hmm. So your visit time is 45 minutes. The treatment actually, with the energy being applied, is a minimum of 20 minutes. Depending on which protocol we're using, it might go up to 30 minutes. And so the entire visit is 45 for you to come and get comfortable in the chair, for us to remove whatever bit of clothing that we might need to, for us to do the injections, and then for us to detach you at the end and wrap up our visit. So it's a total of 45 minutes.
Great. If anyone has any questions they want to ask, you can feel free to unmute yourself and